So this is the first time, by the way, I'm Joy at FieldHaven. We'll do proper introductions in a couple of minutes. I want to really give a huge shout out to Mariah in the Maui Cat Café Maui for hosting this and providing all the technology so that we can do this hybrid event. So we've got a room full of people here live, and I'm going to ask them, try and keep as quiet as you can, except to cheer me on. And then we have a lot of people on Zoom. Bear with us if we have a little glitch, because this is the first time I've done this kind of hybrid event, but I'm super excited about it because Ray was hoping to be here in person, but she did something like buying a house and she had to move. And honestly, I could not do this presentation without her.
So here's our introductory slide. As Joy mentioned, my name is Bree. I'm a co-founder of FIP Global CATS, and I am located in Arizona.
And that is obviously, those kitties all had FIP and are now cured. Just a smidgen of what we've worked with. Okay, the first thing I want to start out with is there's two, like, it's so funny in our world to be online and you see things and you see words. It's like potato versus potato. How do you say? Is it, some people say FIP, some people say FIP. It doesn't matter, but Bree has the perfect response to that, whether it is. It doesn't matter. You can say FIP or FIP. It all is the same.
It just matters that you treat it.
Yes, that is absolutely true. Okay, just a really quick, I'm not going to spend a lot of time on this, but I'm with FieldHaven Feline Center, and I also have Jen Paul here with me. I founded FieldHaven in 2003, and Jen has been with me pretty much from the beginning. And it grew from a very small little rescue, just rescuing a couple litters of kittens, and then just bloomed and has become a huge organization. I stepped down as the executive director a couple of years ago, and I'm kind of on my retirement trajectory. And we currently do have a spay neuter clinic at our main location. And we do a lot of different things, pretty much everything with cat. I'm not going to walk through all of these, but I do want to just point out the very last one, the disaster assistance. That's how I got to know Maui. Jen and I came over after the Lahaina fires, and we helped Maui Humane Society set up the recovery center, who a lot of you here on Maui know as the Annex. So we were here for 2.5 months. We met a lot of you, but most importantly, we met Sarah Haynes at Kitty Charm Farm and have started a very long, lifelong friendship with Sarah. And so that's how I got to be here on Maui. So we come back to see Sarah or see Sarah's cats. But we do a lot of different things.
The group that I'm associated with is FIP Global CATS. You can find us on Facebook with that QR code up there. Our mission statement is up there as well. We've been around for it's either 2 or 3 years. We're on Facebook. We're everywhere. We're a website. We're everything. We're the finest support group for FIP that you will find. And we're also the only one that is not for profit, to my knowledge. And I'm just really proud of the work that we do. We support parents all over the globe, hence the name. We raise money for FIP research, and we provide lots of resources for FIP parents, for veterinarians, and everyone in between.
So we've worked with Bree and Global since 2021. And you might say, well, gee, Bree just said they just started 2 to 3 years ago. Bree and Nancy Ross and some other partners that worked at another organization spun off and became FIP Global. And we stayed with those folks, and we've essentially been working together for over 5 years. So I'm going to not spend a lot of time on the history of FIP, but just for some of you that may not know it, it's not a new disease. It has been around forever, for decades, but it was always a disease that was 100% fatal. I mean, there was just no exceptions. And it always strikes kittens from like 4 months to 2 years. Young kittens that are just adorable and just really getting in your, embracing your family. And then they get this devastating disease for which there was no cure. Dr. Niels Peterson from UC Davis has been researching this disease for 50 years. And at one point he said, I'm not going to retire until I find a cure for FIP. Well, Dr. Peterson is in his 90s. So finding the cure was truly the swan song to his career. And I want to get teary when I think about the dedication of this man. But what happened in 2014, well, in 2018, the dates are a little fuzzy, 2016, 17 or so, he found the cure. But they did a test study of like 25 cats, and they had an overwhelming, I can't remember the exact percentage rate of cure. In fact, I actually know owners of 2 of the cats who are still alive today. So that was back in, I think, 2017. So in 2018, he's like, I have the cure, but he could not access it. No one could access it because the pharmaceutical company, Gilead, would not allow it to be used on cats. So it was illegal to use the cure. And so we all were deflated when we got this cure and it was not usable. Well, in 2019, some people in China managed, and I don't know all the details, no need to know all the details, but they were able to formulate the medication and started making it available worldwide. However, it was what we call black market, not legal. So it was not legal in the United States to use it. But you don't ever want to underestimate the power of crazy cat ladies, right? Because there was a way found to get this treatment to cats. And I personally did it, and I know Bree did. I started in January 2021 and until it became legal in June 2024. I did that, and I know, Bree we all have. I mean, probably many of you in this room used that treatment. And then in 2024, it became legal to use it in the United States through compounding pharmacies. So at that time, I thought I remember thinking, yay, I'm out of the FIP business, right? Because now it's legal. But it has been our next challenge for the last 2 years has been getting veterinarians to embrace it and be knowledgeable about it. So it is now available from over 40 and that number grows every day, from over 40 or more compounding pharmacies across the United States. It is cheap. Relatively speaking, a little vial used to cost about, and some of you may remember this, where it would cost, $80, $100, $120, and that vial would last you maybe a day or two of treatment. And you would spend thousands on this unregulated black market treatment. Sarah's trying to get the kitty off the camera here. And but now it's so inexpensive, and they're even Chewy. You can get it through Chewy. There is variations in the pricing and we'll talk a little bit about that as we go forward. But what we're going to talk about today is, some of the challenges that we face and a lot of other things. Okay, so what do we do, FieldHaven and FIP Global? Where's our role? We're not veterinarians, and we never profess to be veterinarians. We need veterinarians to be on our team. We work as a team to bring the treatment to families, to cats, whether they be a cat that's in a shelter, a cat at a veterinarian, a cat that's owned by somebody. And this is how a lot of you that have treated cats, you came to be known to either us or Global or maybe one of the other organizations. So what we do is we're a liaison with the veterinarians. So like I said, we want to work with the veterinarians. We need the veterinarians. But what we do is we can provide guidance to the veterinarians when they're not familiar with treating FIP. We can provide guidance to them in not only treating it, but also diagnosing it. We can provide support and resources to the parents. Think about any of you that have had a cat that was diagnosed, or anybody they adopt a cat. They adopt a cat here from the cafe, and 3 months later, that cat gets deathly ill and Blue, which we're going to hear from Blue's mama. And the vet says, your cat's going to die. What do you do as a parent? Or they say, well, there's this treatment, but it's really expensive and I'm not sure where to get it, or it's not going to be here for a week if we do start on the treatment. So we're here to help the parents and help with that with the veterinarian together and get you through all of that and through the whole treatment plan. We also, FIP Global works a lot on the advocacy, and FieldHaven, we're pretty local. Okay. We're in Northern California. So we're in the Sacramento area. So that's sort of our locale. FIP Global works all over the world. I had somebody from Morocco call me or message me several months ago and say, I need help. I'm like, I don't know. So I reached out to Bray and she's like, oh yeah, that's Nancy Ross. Let me get a hold of her. Boom. It's like they're all over the world. It's so cool to see that network and how that works. And then, one of the big things too is, especially from FIP Global, they're staying on top of the new and emerging treatments and diagnoses, how to diagnose it, and any new research. In fact, some of the FIP Global team members are on some of the research.
One of the big things we do with the FIP STARS program, with FIP Global, just in general, is supporting veterinarians every step of the way and kind of acting as like an extension of what they provide their clients. With FIP, there are many diagnostic challenges. It was often considered a diagnosis of last resort up until kind of still is. It resembles a lot of different diseases, especially with cats that are a little bit older that you don't really expect FIP out of. So it's really important to rule out other differential diagnoses such as FIV, FELV, toxoplasmosis. If we see a cat with a fusion, we don't want to immediately be like, oh, it's FIP, because it could be cardiac, it could be cancer, it could be parasitic. And of course, just to complicate things, there is no single definitive test for FIP available. We look at blood work, we look at cytology, all kinds of things. A fusion is like a fluid within the body. That's one of the top signs we see with FIP, especially with wet FIP. We also see fever, we see weight loss, lethargy. In blood work, we look at the proteins, we look at the white blood cells. We also suggest doing imaging to confirm the presence of a fusion because some cats are just fat. And then if they do have fluid, we want to confirm what it's made out of with the cytology of fluid where possible. There's also several different types of FIP. We have wet FIP, which is that effusive type that we were just talking about. That can be fluid buildup in the chest or abdominal cavities, sometimes both. Non-effusive FIP is often known as dry FIP, and that can include multi or single organ involvement. It could be the kidneys, the heart, the lungs, like you name it. We also see granulomas within these cats, often originating in the gut. Neurological FIP often presents with seizures and ataxia. Ataxia is when they're walking wobbly, they look like they're drunk. Ocular FIP often presents with uveitis. On the left there, we have one of my foster fails, Mosquito, who was once told that he has a whole bunch of FIP because he had wet neurological and ocular. He's been cured now for quite a while and he's doing really well.
Trifecta.
Yeah. Yeah. That was the night I took him in and I was like, this cat's going to die in my house. And now he is raising holy hell in my house. So he's still kicking and he's doing amazing. We have lots of resources for veterinarians and for parents who are treating their cats. Really, cat lovers, cat owners, cat acknowledgers. I feel like if there is a cat in your life in any way, you should know about FIP. And those resources are listed here. FIP Vet Guide is like a handbook of sorts for veterinarians. FIP Friendly Vet, that's like a directory to find a vet who is familiar with FIP in some capacity. It could range from their clinic stocks medication to they handle the cat's case and they did great. These are just who we recommend, and it's a community-driven directory. So if a parent says, my vet was great, we add them. FIP Safe talks about different black market medications that have been recalled or had issues. FIP Treatment Guide is also a handbook of sorts. It goes through different topics and categories related to FIP. And then there's the Every Cat Foundation as well. And then to the left is my cat, Archie.
Tell us about Archie.
Oh, I'd love to. He's a terror. He had thoracic FIP and he's doing great now. You'd never know he was sick.
4 years, almost 4 years cured.
Yeah, that's my boy.
Every Cat Foundation does a lot of research too, right?
That's correct.
The research.
And then on the topic of treatment, evolution, and protocols, we have my cat Audrey. This is really just a collection of my cat pictures that I'm forcing you all to appreciate. Audrey has been cured for several years as well. She was the wettest wet cat I've ever seen. Her abdomen dragged. She was so full of fluid. So in the early treatment landscape, we had what I call the underground years of FIP treatment and GS 441524 use. Joy touched on that earlier. That was when we were receiving GS from overseas, and there were Facebook support groups and for-profit drug distribution groups, which largely has been nixed in recent years since the legalization of GS, which is wonderful because now we have reliable medication as opposed to something made in a bathroom. And there was also informal sharing of dosage protocols, and it's like, well, this is what I did for my cat and it worked, and then people did it again and again and again. Back in those days, we had fairly limited vet involvement just because vets were scared, which is very reasonable. These vets didn't know if they would be punished, if their licenses would be revoked, things like that, for just even seeing these cats for blood work and basic monitoring. So as time went on, vets became more involved. We saw protocol standardization, more rigid guidelines of like, okay, if the cat has wet FIP, we could do this. If the cat has neurological FIP, we could do this. And just refining that cats with more severe symptoms, such as neurological and ocular, those are cases where the virus has crossed the blood-brain barrier, and adjusting dosage accordingly for them. We also learned about the importance of supportive care and feeding the cats and different steroids and things like that, and what is best for each individual cat, really looking at the cats individually and not doing a blanket suggestion. Currently, we have several different drugs that are available in different degrees of popularity. I would say GS 441524 is the most readily available and the most popular option. When we wrote this, there was a growing number of compounding pharmacies. Now there's like maybe 40 or 50, which is super cool. All around the globe, there's some pharmacies that you could pick up same day and start treatment immediately. And that's just crazy to think about from where we've come from. These pharmacies have different forms of GS. There's the liquid oral, there's the tablet. Some of them do offer injectables. I believe that is less common though. There's also molnupiravir, which is great for cases of relapse or those stubborn cats who just will not, progress with just GS, cases of resistance. We also see the use of remdesivir in certain regions, more commonly overseas. And we're still learning a lot about Paxlovid. You may have heard of that drug with COVID treatment. That's often used in conjunction with GS or molnupiravir. Orally, it's not the most fun to administer, as I'm sure Joy can testify to, but that's a great tool for cases that are more stubborn as well.
Because some vets are doing that as, can you talk a little bit why that's not, we don't recommend that as a front line or first course of treatment?
So GS is considered the gold standard of FIP treatment. There is a mighty fine drug, but it's often not needed right off the bat. I like to reserve that for cases of resistance, relapse, things like that. There's some cases where we'll start the cat on molnupiravir just based on availability, but generally GS does the trick, and it's good to just keep molnupiravir in your back pocket if you need it for like a trickier case.
Because there are some adverse possible side effects to it, right?
That's correct. It does have stronger side effects. It can cause bone marrow suppression if it's not dosed correctly. It's definitely less palatable. Cats complain more about that one. It's just not as friendly as GS, is my understanding.
And I did see something just popped up. Somebody mentioned EIDD. Yeah, so sometimes we see that. So can you talk about that?
EIDD and molnupiravir are one and the same, yes.
Yes, it's the same thing, yes. Okay, thanks.
You're welcome. And then as we're going through the course of treatment, it would be nice to say your cat just needs one pill for 84 days and then we're done, but that's not how it works. We have to monitor their weight at least weekly and adjust their dose as needed. We suggest doing blood work at day 30, 60, and 80, definitely before stopping treatment to make sure everything is good to go. Periodic exams by your veterinarian is also a great idea, just so someone with trained eyes can keep an eye on your cat, feel for lesions, things like that. And of course, like radiographs, ultrasound, things like that may be needed as necessary. And your vet is also so helpful with managing instances of resistance and relapse. And that can also help pave the trail of if you need to add on a different antiviral, switch to a different antiviral. And then we also monitor for the observation period, which is another 84 days after the completion of treatment.
And I got a couple, I want to add my kind of 2 cents into this. This is a really important slide. If anybody wants to take a picture, whatever, we'll send out the slides, the deck to you. But this is super important. And this is where we see a lot of relapse happen because your cat gets better. They're doing great. Their blood work looks great. Okay, maybe we don't need to do all 84 days. Do the 84 days. You need to be consistent with it. You need to be consistent with the monitoring and the protocols of changing the dose for the weight. So really, these are the things. This is something that we really want to emphasize to veterinarians too, because like Bree said, okay, this is your cat for 84 days. We have actually had veterinarians. We've heard people have told us, the veterinarian said, give it to them for 84 days and come back and see me. No, we've got to do the monitoring. They need to be adjusted for their weight. And that is super important because we don't know. And do we talk later about the shortened period? We might talk about that a little bit later in the slide. Or do you want to talk about it here? We can talk about it here.
Talk about it whenever you'd like.
Whenever we want. So it's our presentation, right?
We're in charge, Joy.
So, and just an example last week, and this was nothing we did wrong. I mean, we did a kitty's named Buffalo Chicken Dip, and he came from UC Davis. He was transferred. They named him over their Buffalo Chicken Dip. We got another one named from them named Hummus. So there's some sort of theme going on there with naming. The Buffalo Chicken Dip did really well in his treatment. Everything was going along. He had a little bit of, he was neuro, so there was, a little bit of ataxia and stuff, but he did great. And his blood work looked great. It was just on course. So we stopped. We all agreed, even UC Davis, Dr. Verneau at UC Davis, Bree, Dr. Jen at our facility. We all agreed. Okay, they're the ones that make the agreement of the treatment, not me. I tell the fosters what to do. So yeah, we're ready to go into observation with him. He was in observation for about 6 days, maybe a little bit more. And the foster reached out to me on Friday and said that Buffalo Chicken Dip he's lethargic and he's not eating well. Does he have a temperature? Well, she didn't have a thermometer. So I said, get to FieldHaven. He had a temperature of 103. We did blood work. I sent it to Bree and Dr. Jen on Saturday morning. And guess what? He's relapsing. So we got him right away back on treatment. And he's already doing better. He's almost back to himself. But I just asked the question today. Bree, what question did I ask? Do you remember?
No. For 84 days.
Yes, that's the question I asked.
I'm good. And the answer is yes.
Yes, we got to go back. We have to start all over again. Kind of a bummer, but
Did you change the medicine?
we upped it. You're right. Good question, Sarah. Yes, Dr. Jen and Bree.
Or you didn't go to the mono or whatever?
No, we didn't change we stayed on GS, but we upped the dose. We increased it by 50%. And so he's now on 30 mg per kg. So
Correct.
rather than 20, which was the straight neuro dose. So, but he's doing great. We have Bree had told me a long time ago, this is the only second I jinxed myself because I only had, just for reference, right now I have 16 cats at FieldHaven that I'm managing with FIP, either treatment or observation. So we do a lot of FIP kitties at FieldHaven. Last year, I only had one relapse, and that was in January 2025. So I jinxed myself and said, last week, I think, and said, I haven't had a relapse in over a year.
Oh,
Yeah, but that's what I did. But Bree told me a long time ago that relapses almost are always taken care of in the second round. And that's what my experience has been as well. So the monitoring for the observation is also important as well, because that's usually when you will see the relapse. Okay, that was my 2 cents, but that was more like 10.
That was very valuable. Perhaps even a quarter, Joy.
So, hey, Bree, let's take a second and tell people here. So what Bree does is she manages the cases. She's got, how many cases do you have going right now?
Definitely over 100, probably somewhere between 100 and 200 around the globe. Majority of the cases I assist with have been concentrated to the US. All of us within FIP Global are assigned different states, different countries, things like that. I handle 18 states, Romania, and Portugal.
Maui.
And Maui. Well,
Sometimes, sometimes Maui too.
yeah. So, and that's just right now. These cats get cured and they fall off, kind of go off her radar. But this woman knows, I mean, she knows FIP like nobody else does. Okay, go ahead. You can carry on.
So the cat in this picture, that's my phrase that pays tonight, is baby Basil. He's been cured for a little over 3 years now. He was adopted by my friend in Las Vegas, and he was a very wet boy. Here he is at the beginning of treatment, and here he is just 11 days later. You can see the remarkable transformation. All I was doing was GS with him and prayer, and he made it. He's doing great. His only complaint in life is that his food bowl should be full more often, but he has the best life and he just makes my heart happy.
They do. All of them do. Before we move on, I want to actually ask Lisa if you'd like to come up here. This presentation is in honor of
Blue was the Cat Café mascot cat. And so Mariah asked me to foster her because she had gingivitis or she had gum disease. And so she was supposed to get her teeth all extracted, but the vet decided not to go ahead and extract her teeth. And so when she came to me, she had a few teeth that are extracted. I started in July and I had Blue at my house and I was caretaking her as she got better with her gum disease. And when I got her, she also had ringworm. So we cured that and we were waiting out for her gums to get better and then the ringworm to go to extract her teeth. About 3 or 4 weeks after that, Blue was starting sneezing and having upper congestion issues. So we treated for that. At that point, the ringworms came back after we had cured it on her back and it was bigger sores on her back at that point. So the vet just said, well, let's do a shampoo. So then we started shampooing Blue. Then it took a lot longer to get the ringworm to go away. And at that point, she started taking longer to heal for everything. I took her back to the vet to check her teeth. I was concerned because she went from 8 pounds to 5 pounds. And that was really hard. And the vet was very, worried about that. Again, her sneezing and congestion kept coming back, even though I was treating it, and it would go away and would come back. Again, they also had elevated temperatures that were coming in and out. And then at one point she got ulcers. She started gagging on her food and pills. And so we took her back to the vet and they said that she had ulcers. So I treated that. We did go to a third veterinarian. This is probably about 3 months in, 3 to 4 months in. This is in November at this point. So we took her in and we said, well, maybe we thought the whole entire time that it was her gums was her issues, that she just was immune compromised. So the last vet we took her to, because she was very lethargic, she was losing more weight, she was losing muscle mass at this point. And we took her in and they did blood work and said, well, let's try to get these teeth out because that's the problem. It's like, okay. So then on Monday, we got the blood. Wednesday, we went in and they said, they looked at her blood work and her white blood cells and her red blood cells were completely off. So they went ahead and drew blood to test for FIP and said, there's no way we're going to take her teeth out. So that was a Wednesday. She came home, was fine on Thursday, and then Friday, she passed away. So the next week, we got the results back as far as FIP, and she tested positive. So I just know that Blue was, dear to everybody's heart here at Maui Cat Café, and to me too. And that was my story of Blue. And I just want to thank Mariah for helping the cats of Maui.
Thank you, Lisa. And thank you, Lisa, for sticking by her. I mean, all of you that, stuck by, went the extra mile. And those are the kinds of things that we know, it's hindsight, but let's learn from that, not the veterinarians, hopefully, and everybody learn from it. We've got to look for FIP. Sometimes we're not sure what it is. So I also have a happier note we have Janna, who's on Zoom. We're going to hear Jenna's story about her kitty. And there's an interesting connection here, 6 degrees of separation with Jenna's kitty. So Janna, are you on?
Yes, here I am. Okay, so we adopted Zap in February of 2024. And we couldn't bring him home on the plane. And the director of the Lanai Cat Sanctuary just happened to live, his parents lived in Phoenix. So he said, well, I'll bring Zap home. So we got him home and he was tiny. And that's actually why I liked him so much. Mariah will remember. I was obsessed with him when I saw him because he was so tiny. And he was 3 years old. And he weighed 4 pounds. And we got him home and he was just a bag of mess. We took him to the vet and he was a carrier of calicivirus. And so he gave that to all of our cats here. He didn't show any symptoms for that, but they all got like mouth sores and easily treated. That was no problem. After that, he started losing weight big time. And he actually really had no symptoms. And before I adopted him from Maui, I asked Mariah if I could have him tested for FIV and FELV because those were the only two that I knew of. And I said, look, I'll pay it. Even if he's positive and I don't adopt him, at least whoever does adopt him will know that he has that. Everything was good. So we bring him home. He is a carrier for calicivirus, no problem. We treat all the cats. And he's just started losing weight. No other symptoms other than he was eating, he was drinking, but he just looked really depressed. Like he would sleep a lot. He'd get up, he'd play a little bit, then go back to sleep. So we took him to the vet and she said, look, I think he might have FIP. She's, let's test his levels. His levels came back to like 12,800. And she's like, this cat's not going to make it. She's like, you need to contact FIP Global. And oddly enough, Bree was assigned to us and she only lived 2 hours away. So she said, I'll put some medication on the porch for you. And it's in a cooler. So we drove down that night, picked it up, and it was the easiest thing. We did the shots. He did develop some sores on his back for all the shots. And we just stuck with it. We even had a big trip planned, a big family trip planned. And our poor cat pet sitter, I said, listen, I got to make a video for you on how to do these vaccines on him, do these shots on him. She would FaceTime me every day, holding him, giving the injection, just so we knew he was getting it. He was never missing a day. And yeah, he's been cured since August of 24. So a year and a half.
And we saw him live and in person.
I know. And all of a sudden now he ran away like he's too good to hang out with us. So, but he,
So that was
it-
before the treatment was legal then.
yes. Yeah. So, and they were really quick with getting, yeah, that was before it was legal. So it was really quick coming from China, I'm assuming is where it came from because I could never read the packaging on the label, but it got here within like 3 or 4 days. And I was concerned about the original first dose, but I'll tell you, Bree said, look, I got some, I'll just put it on my porch. It's in a cooler. And it worked wonders. And I contact Mariah right off the bat. And now he's getting too heavy. The vet says he has to go on a diet. So he went from 4 pounds to now he's almost 9 pounds. But he's turned into a nightmare. He bullies every cat in the house. I'm like, okay, you got to stop now. Like I baby him way too much.
Of course you do. Because he's a $1 million cat.
And every time he even sneezes, I go, oh my gosh, is he sick? But I will say, I take him to the vet every 6 months. I don't even know if it's necessary, but Bree told me, I think you said do it for a year. I still go every 6 months just because I panic. And she does a full blood work and she always says, Janna, everything looks good, but I still send it to this day. And actually, I just got it done last month. I have to send it to you just last month. I need the comfort of knowing that we're still good. It's worth it to me. It's like $200-300 for a blood work every 6 months, I'll take it. No problem. The amount of money we put into it already, what's another $200-300? It's worth it. Yep.
Oh, thank you, Jen. Thank you so much. And give that boy a kiss from all of us. It's gonna
I
be
know.
lots of-
Now he's running around looking for shrimp.
He left the violin.
Oh, he wants the violet hippies. Yeah.
Yeah, right?
He did not provide permission for us to share his case. Sorry, buddy.
Oh, and also now too, he is literally, now he has gingivitis, so that he has to have some teeth pulled, and he has some bladder stones. So now he's on a special diet. So he's really just milking it. But I'll tell you, he's never been more playful and energetic than he is now.
Wow, that's fabulous.
Completely separate cat. Yep.
All right, go Zap.
Yeah.
So a couple of things that I want to mention, just so a clarity, and Bree, you can jump in on this as well, is when you mentioned his levels, you were probably talking about the corona titer. But the corona titer is really, in a lot of ways, irrelevant. It can be a little bit of a tool, but every cat, pretty much every cat you're going to test for is going to have a corona titer. I don't know if there's anything more you want to add to that, Bree.
I don't really put a lot of value into the coronavirus titer because, like you said, almost every cat who's been around other cats, shelter, street, cattery, dumpster, they all have coronavirus, and the level that they have coronavirus doesn't tell you much about FIP.
Okay, these are some of the frequently asked questions, and probably you guys have a lot more, but I get asked this a lot, and I'm sure Bree must too. Are we seeing more FIP? But I don't think we are. I think we we never wanted to diagnose FIP because we knew they were going to die. So we're trying failure to thrive, just kittens not doing well. We would try everything else so we couldn't identify what it was. So I don't think we are really seeing more of it. I think we're just more aware of it. So now we almost wish sometimes and whoever thought we would say this, when you have a kitten that is not thriving and you can't figure out what's wrong with it. And, we're saying, God, I wish it was FIP. I hope it's FIP because we can treat it. Yeah. And it's so none of us ever thought we were going to hear that in our lifetime. So is FIP contagious? No, it is not. I hear that a lot too from people I think it's contagious. It is not contagious at all. The coronavirus is transmitted through feces, and that's why so many cats have it. But FIP is not. In fact, we really encourage, if your kitten has a buddy, we encourage you, don't separate them, because that sick kitten needs that mental health to be with another kitten. My veterinarian won't treat FIP. What do I do? This is a matter of, helping there's a lot of great veterinarians out there. I work with them all the time. A lot of veterinarians will call me, and I'm sure they call Bree too. It's like, hey, I got a cat with FIP. Can you help us get going? Can you help us? What we need to do next? But there are some vets that just really don't want to get involved. So that's when you can call around. I did this for a customer last week who was in my, in my area in Lincoln. And I just called a couple different veterinarians and said, are you treating FIP? And I found one. And they said, yeah, we are. Great. Super. So that's where she went and made an appointment. And the more that we can get it more mainstream, because, you think of for us, it's super important because we're all about FIP and diagnosing it and treating it. But veterinarians don't see it that often, honestly. So it's one of those kind of little orphan diseases. So it's okay to say, I need a veterinarian that will treat FIP. And that is important. One that's going to be agreeable to it. A lot of times on our treatment chats, the veterinarians will join in and because they want to learn. What are the chances of my kitty relapsing? It's really, Bree, what do you put this at? I mean, I don't know how we do a percentage of it, but it's not.
I think it's 10% globally. It's tricky because there's always those parents who do everything perfectly, and then a few days after stopping treatment, they're like, he has a fever and he's not eating. And I'm like, no, but it happens. A second round is almost always curative. It's not the end of the world. It's just kind of frustrating.
And a lot of times, there are those cases like buffalo chicken dip where everything was done well, but there are those cases where we can pinpoint it, where they stopped treatment or they didn't adjust for weight or something like that. Bree, I'm going to ask you to take the last two.
questions
I would
there.
also like to add to our third point, my veterinarian won't treat FIP. What do I do? My stance on that is just be your worst. Make them treat FIP. Teach them everything. My own vet, I like to think she is my bottle baby. I taught her everything she knows about FIP. She's on here tonight. If she ever has a question about FIP, we call, we text. Make the veterinarians care about FIP. It's not a death sentence anymore. They know it. I send my clinic links to every CE I can find. I'm like, look, you can get credit. Make it appealing to them and make it something that they're interested in, especially if they see a lot of cats. And if they still won't treat FIP, I don't know, send them some crumble or something. It never hurts, right? Kill them with kindness. As for the vaccines, though, I do suggest vaccinating for FVRCP during the course of treatment. I've had cats die of Panleuk during treatment, and it's a very frustrating thing because it's like Panleuk is preventable with vaccines. So I do encourage that. Rabies, I usually hold off on unless there's a real risk. The cat goes outside, the cat's exposed to other cats, things like that. As for spay and neuter, I suggest doing that during the course of treatment, typically around week 10, assuming the week 8 labs are looking good. If they're not, hold off. Extend treatment. If the parent is not able to get labs done, is not able to get the spay or neuter done around week 10, you want to extend treatment 2 weeks beyond the spay or neuter date and recheck labs prior to stopping.
Why not just wait?
Well, because you want them, because it's an assault on the immune system. So you want them to be continuing to receive some of that treatment after the spay neuter. And now this is my time to talk about cats, okay, that are on here. Mochi is not my cat, but he was cat 1 that I started in January 2021. He is a FieldHaven alumni. And so he was the one where I went out there and the owner called and they managed to get the medication. And I went out there and I remember my hands were shaking giving that shot because at that time that shot was worth a lot of money. And Mochi you can find him on Instagram. He's got several pages and he's kind of a famous little kitty right now. And his mother is like Janna. She takes him to the vet every 6 months. Every time he twitches a whisker, she gets him to the vet. But he has been incredibly healthy. I think he did have one unrelated infection or something at one point. But he's over 4 years later, he is totally healthy. Okay, next slide. So this is just a flow chart of how we work together. It might be because you guys can't see this. I can barely see it. Let's just go for it. Yeah, thank you. So looking forward, what's next? So there is a lot of things that are in the works. There's continual research being done. We're very fortunate, FieldHaven, that we are very close to UC Davis, and actually the vets that are doing at UC Davis that are doing FIP research, they actually sometimes call me and ask questions about things, just because we see so many. But they're doing, and they're who I contact. I can contact them anytime and ask them questions, which I do frequently. We do at FieldHaven. We get a lot of their kitties that come in that don't have an owner or the owner surrenders them. We'll start the treatment there. So there is a lot of things going on in the research area, which I'll talk about one of them in a little bit here, but different in the use of different antivirals. One of which is Paxlovid, which I'll talk about in a little bit. And then vaccine research. They are working on that at UC Davis as well. And there was some breakthrough thing about a year or so ago, like they identified some little cell, or I can't talk in research terms, but there is forward progress on a vaccine. And now, won't that be a glorious day? We have a vaccine for FIP. The shortened treatment course, you'll hear out there, and I hear from people, and I let Ree talk about this as well, we've heard with wet cats, with wet or effusive FIP, doing a shortened course of 42 days. So 6 weeks rather than 12 weeks. And Bree, can you talk about why we're not recommending that at this point?
Yeah, so the study of the 42-day treatment period was done on very few cats with quote unquote simple cases of FIP. So cats that had just straight wet or straight dry FIP. It was a very small sample size. We just don't know enough to comfortably say that's a safe decision. So we're not recommending that at this time.
And because the treatment is no longer giving painful injections and the treatment has become so much less expensive, let's just stay until we have solid evidence that we can shorten the treatment. Let's not mess with it. Let's just keep doing those extra 6 weeks. That's our feeling. So long-term monitoring, I agree with, what Bree said and what Jen is doing. Regular vet care is important because we don't know. I do know 2 of the cats in the first, actually 3, I think, of the cats in that trial that Dr. Peterson did in 2015, 2016. And those cats 10 years out are doing well. I think one of them right now, Peter Cohen's cat, I think that's the one he has got cancer now. But I mean, the cat's older, so who knows if that's related. There are some things that there's been a little bit of nibbles of research on or things that they see that may be a bladder stones. There's a particular type of bladder stone. So it's not just regular bladder stone. There's a particular type of bladder stone they've seen in some cats. Hydrocephalus is a very new one. And we actually had one of the cases that Bree and I were working on. He relapsed right after observation, and we had him start back, and he had actually been treated through UC Davis. That was who their vet was. And they lived quite a ways away, so they couldn't get to UC Davis right away. So Bree had them start. They had some medication left. She had them started on it. But then they got to UC Davis. He was hospitalized. They treated him, started as a relapse. And then he just got worse and he crashed, and they took him. He was in ICU and he passed away. And they did a necropsy and they found that he had hydrocephalus, which the pathologist said this is the second time he's seen hydrocephalus in an FIP, a cured FIP cat. So that's just very rare, but another sort of thing that can happen. And some cardiac conditions I hear, I don't know if you have any more information on that, Bray, but I know that sometimes we hear about cardiac conditions.
A lot of cats with wet FIP, that fluid's kind of sneaky, so we don't know exactly where it's going. It could be in the pericardial sac, which is the sac around the heart. And in cases like that, if the cat has not yet been spayed or neutered or is ever going to undergo a surgery, I usually recommend doing a cardiac pro-BMP at some point, just to kind of get an idea of their heart health before doing a surgery on them, because you don't want to find out your cat has a heart issue the hard way.
Difference in the success rate of treatment wet versus dry.
No. The question was, is there more of a success rate wet versus dry? I have not seen that. I haven't really seen that. Bray, I mean,
in theory, a cat with like just straight wet abdominal FIP is going to be easier to treat than a cat with neurological FIP. But I wouldn't say the outcome, like speaking broadly, is different depending on the type of FIP. Like it might just be harder to get there, but you'll get there.
Exactly. Thank you. You put that very succinctly, because some of these neuro ones would go through hell. This is Poppy. She's a FieldHaven FIP star. She was from the Bradshaw shelter and actually been adopted out, and 3 days later came down with FIP. So she was transferred to FieldHaven, but stayed with her parents. And she's been cured now for a couple of years. And her mother is a colon cancer survivor. So Poppy often helps her mother promote colon health. So that's why we have the little colon stuffed animal on the top there. But Poppy is also promoting FIP a lot too. So she's one of our superstars. It's like beats the FIP drum. How we can expand upon, this is kind of common sense of everything we've talked about, but expanding our collaborations. We want to work more with veterinarians and researchers, pet parents, what you all as pet parents or those that are here as pet parents, the information that you share about your cats it's not used as specific data research, but it's anecdotal. This is how Bree learned so much, and how she's learned so much. It's so important to share that information, and then being able to share that information with veterinarians. And then also internationally, there's different research going on internationally, and learning from all of that. There's still a lot of opportunities, just like tonight, what we're doing, just getting together and going through what we know and sharing that and enlightening. So that's a lot of what we want to continue on that. And that's a lot of what we're about right now. Where do we go from here? Stay informed. I mean, if you're just a pet parent, if you're but if you really have an interest, and so many people like Bree was a pet parent whose kitty got FIP, and now look at who she is. So you can all become that too. If anybody wants to become a FIP Global admin, just talk to Bree. But stay informed and share cases with veterinarians and others so we can bring all this knowledge together collectively and advocate for accessible treatment in the United States and globally. Because it can only available through compounding pharmacies. There is, I think, remdesivir. There is some aspect of remdesivir becoming legal here in the United States. But, it's still not readily available as much as we would like it. Veterinarians are not stocking it. You've got to wait days to get the medication. And then speak to your veterinarians. When you talk, even if your cat's fine, when you're at your veterinarian, say, hey, do you know what do you see with FIP? And share what you know about it and encourage them to learn more. That is Gridley. Okay. Quick story about Gridley. So he is my first that I treated all by myself. That one that I fostered. This was in 2022. Actually, no, it was in 2021. And Gridley is now a permanent part of our family. He's much bigger than that and much, much fatter. But the cool part of his story is you see that picture of that kitty there. That is Levi. And Levi is a kitty I lost in 2006, I believe, of FIP. And I was like, when he was diagnosed with FIP as a kitten, I had adopted through FieldHaven. I was devastated. I was like, he's not going to die. I tried anything I could find, homeopathy, anything, any possible thing I could find. And he died of FIP. And I had his pictures been sitting on my desk for 20 years or more. And I was like, someday, Levi, I'd look up at him sometimes, someday, Levi, we're going to be able to do something with FIP. Well, there we go. So but here's the cool part of it. See the little dangly thing on Levi's collar? Or on Gridley's collar, that was Levi's collar tag. And when I was treating Gridley, I was cleaning out some drawers and I came across Levi's collar tag. So that was like my special spiritual, like, okay, Levi, you have been, we got this. So, okay. So treating FIP in your organization, those of you that are here with either a shelter or a rescue or, someplace, not just as an individual parent as a veterinarian, thinking about how you're going to treat it in your organization. Do you have the resources and the capacity? You got to ask yourself, this is a 6-month commitment. And while the cost is greatly less than it was, it still is, it's going to be several $100s or maybe a little bit over $1,000, just depending on the size of the cat. So think about that and don't jump into it unless you can adhere to the treatment plan. So that's my little word of advice. If you're an organization and you have kittens that are adopted from your organization that come down with FIP, within a reasonable, let's say they come down with FIP within 30 days or whatever, just set a policy, or if you are going to help them. Now, I'm not going to go into stories with this, but if you think about the kids, have some sort of policy that either you are not going to treat it, or if you do, how are you going to help the pet parent? If this kitten that you just adopted out, 30 days later, it comes down with FIP. You don't know it. There's no way you could prevent it because we can't test for it. We can't vaccinate. So it's nothing, but we at FieldHaven, we feel an obligation to those pet parents. And so we do help them. So that's our policy. But be thinking about that within your organization, what your policy will be. If non-shelter cats diagnosed with FIP. So will you, if you get somebody calls you and says, I have a cat that's just been diagnosed with FIP, I can't afford to do the care. Think about if you can help or if you can't. What we do at FieldHaven is we try and make it affordable for them because a lot of vets are still saying it's going to cost you $5,000, which it doesn't anymore. But what we will do is we'll intake that cat and shoulder the cost because we can actually treat a little bit less expensively because we're fortunate enough to have a clinic on site. We have our own veterinarian. And then the parent continues to foster. And then once they are cured, we adopt them back to the parent. But these are things just to think about because FIP is out there. And now that you know about it, or we already do know about it, but now that you know a little bit more about it, people are going to start calling you. Assisting pet parents. That's a lot of what we do. And sometimes Mark was just here, who he stopped by a little earlier. He called last week just through a channel of people and he needed help. His kitty was just diagnosed. His veterinarian was a little not, they were ordering the medication, but it wasn't going to be here. And it's like now over a week later. So we helped him. I helped him I happened to bring some with me. I helped him with some bridge medication. So, and then answering his questions, because he and his wife were just like, what is this? And partnering with veterinarians. So a lot of veterinarians now call us. They'll say, hey, we've got a cat with FIP, or we think it does. Can you look at the records, or can you help us talk to the parents, or can you provide bridge medication because we're not going to be able to get the medication, Chewy's not going to be able to deliver it for 4 or 5 days. So those are all kinds of things to think about as a shelter and what you can do to help in the FIP community, and just do what you can realistically within your resources, because anything you can do is a positive. And then one thing I want to talk about too is municipal shelters. A lot of municipal shelters don't have the luxury of taking on a kitten to treat for 6 months. They have depending on the shelter, they may have policies that we're not going to treat. But what we do is we try and work with them. They often will call us and we'll take the kitten in. Sometimes they will give us a little bit of a stipend. Sometimes they will do it. They actually will treat it, but that's a big ask of a municipal shelter to take on something that's going to take at least 6 months before that cat can have an outcome or be adoptable. So those are some things to think about for those of you that are here with rescues and shelters.
Somebody who's
Sarah, come up here and talk about it.
during the Maui fires, we rescued 2 cats a couple weeks apart from 2 totally different locations. One from a hotel that was in the bushes that Lindley called me about, and who was blind, and I didn't know anything about FIP other than 2 cats had died in my past that I now recognize had FIP. We do a rescue, so we have lots of cats coming in. And then another one from the fires that we literally ran out of the fires. And Joy had just arrived, and we had been talking before she was hired by Maui Humane. And the first one was diagnosed with FIP. And she's like, bring it over. We're in Kahului. I know what you need. It was just such a lucky stroke. And that kitty that was blind, a kitten that was blind and very sick, within 4 days could see. It was amazing. Fully blind, like couldn't see anything that come out. The cat like that just sat there. So that was an introduction to FIP, curing FIP for me. And now we've taken about 20 cats in Maui and done it with Bree and Joyce.
Yeah, you got it. But
Yeah. So municipal shelter, if you're in Maui or any islands, get them over to me. I'll help you. But the Revolta test, and I don't know much about it, but I think Bree, maybe you're the one who told me to do it. But with wet FIP, there is a test that's really helpful where you take the fluid out. I'm probably not saying this right, but they remove fluid from the belly or the abdomen. And there's a way to test it that's super simple and costs nothing, with white vinegar and dripping it in and seeing if it floats or not. And I've now brought white vinegar to Maui Humane when they had somebody, and to the Makawao vet. And I'm like, okay, read this pamphlet. This is like, they're now doing this and it's really helpful. And those vets are all now doing it quite a bit. And hopefully, I know a lot of vets here aren't doing it yet also. And so, yeah, I'm hoping, Bree, that you'll talk about that. And then additionally, the costs, like the first FIP cat that we were able to save probably cost $4,000 with all the tests and everything. And now we're not like $600, $800. Like we are, and that's with every blood test for 6 months. And if you had a real financial problem and you had to skip some of the blood tests, you would be in such a reasonable number. The expense is all the tests when the vet doesn't know what it is. And if you can get straight to the tests that really help these guys, and these guys look at it, you can go right into treatment. And that's what we've found now. It's like a non-issue for us at this point.
yeah, you don't want to delay treatment at all. If you think it's FIP, let's treat, I mean, within reason, obviously, but if it's something that is within the scope and you're not sure, it's okay to treat. You're not going to harm the cat by treating them and seeing if they respond in a couple of days while you're still working it up. You're going to be that much further ahead. And probably, and I'm going to say just on the outside, 80% of those cases turn out to be FIP. But we have had some that are something else. So we can then stop the treatment. There's no harm done if you stop the treatment, or if you do the treatment and then you stop it if it's not FIP. The cat, it won't harm the cat.
I think I shared with you the other night an experience we have here a lot because at least up until recently there were so few vets that we even entertained the thought is that they would rather throw darts against the wall for 8 other diagnoses.
Yeah.
Than
Right.
to begin to treat for FIP and define what it really is.
Yeah, and that's a really good point. It's what you want to do. You want to reverse that thinking, because now we have a treatment. So let's say it's just like vets giving for a fever. Okay, let's give some antibiotics. We're not sure yet because we might need to do some blood work, but let's see some it's not quite that generic. If FIP is in the realm of possibility, it's not going to hurt to start treatment because you don't want to delay. That's where we lose cats, is in that delayed treatment. And so what I call the bridge medication is still that injectable that we get that's unregulated. I would love to not have to use that ever again. I would love to. I don't use very much of it, but the fact of it is not very many veterinarians stock the GS because number one, they don't see it that often. And number two, it's got a lot of it has the short shelf life. Is that correct, Ray? What you would say is accurate?
It has a fairly short shelf life, and some states, like I know Oregon off the top of my head, it's not even able to be stocked in the clinics.
True.
Sure.
Yeah, California, I think, just changed that law, but maybe not. I don't know. I can't. Yeah, because we do have some now at FieldHaven. We do stock some at FieldHaven that we have for it's actually. So we were able to change that. So if you get a kitty that's diagnosed, or we think it's FIP, and I mean sometimes it may even be only 36 hours till you get the medication, but in those 36 hours, that cat could decline rapidly like that and die.
And
So-
so it's like a week.
Yeah, for here it's like a week, and a lot of times even in the mainland, it's still several days. So that's what we use what I call it the bridge treatment for. But I want to get that kitty off. There is no reason to use the injectable. It is actually the pills or the compounded medication is more reliable and obviously more palatable and easier to give. So if you'll hear some people say, oh, you got to treat it for 2 weeks on injections. No, you don't. It's just used as an emergency to get that cat going. There are times because I've actually been called into a couple of vets, especially like emergency clinics or 24-hour care clinics where the cat is like comatose and they can't get orals into it. But they haven't, they're going to probably put a feeding tube in, but they haven't done that yet. So I can get them started off with an injection. So I've done that before, but that's the only time you really need to use the injectables.
What is the shelf life?
It depends on the compounder, and I think also whether it's pills or liquid.
Well,
So
liquid, they say like 3 months.
Yeah.
Ones I'm getting, but we put it in the fridge and done a year later. It's great.
I don't know that I want to take the chance.
Yes.
With the compound, I don't want to take a chance that it's not after that. We all know with expired, Tylenol or whatever, it's fine. I honestly don't want to take the chance. I want to give a special thanks and talk about Papa Ben. Papa Ben is an older kitty that was brought into the UC Davis ER, being found in the bushes. And not only did he have all of the, typical, he's not older, he's probably 3, but he looks old. But he was Tomcat. And Papa Ben, he sailed through his treatment. He did great. And Jennifer's got 21 cats waiting on her. And so he's one of ours just recently, just this spring. He was deemed cured and is doing really well. So I want to give a special thanks. None of these folks are on this meeting, but I really want to give a special thanks out to our own FieldHaven's own Dr. Jennifer Yee, who is our medical director, who really didn't know much about FIP either when she started FieldHaven. I'm like, FIP, we got to do it. We got to do it.
You're gonna learn.
She has embraced it wholly now. I mean, she is amazing. She's like on it, right, Brie? I mean, She is, she's come to me with a couple, she goes, Joy, I think this cat might have FIP. And I'm like, but you know, I love her and she's so supportive of all this. And my wish for all of you is that you could have a Dr. Jen at your disposal. Also, Doctors Karen Verneau and Alba Planis at UC Davis they are my heroes. They are my go-to. They are always available to me. And I just adore them. And they have given me so much help and so many other people, so much help. Dr. Planis is actually, I always like to, this is a brand new kind of a position. She is a feline pediatric specialist fellow at UC Davis. It's a brand new specialty. And she's like the first of it. And she is like, again, absorbing all this information about everything pediatric kitten. So that's I want to give out those special thanks to those ladies. Thanks for being here. We wish you were here in person, but next time. But thanks. Thanks for everybody that attended online. You got our contact information there. You can reach out to either Bree or I. So, okay. Thanks everyone.